Welcome everybody to this month's MDA Advocacy Institute. Tonight we're going to focus on two bills in particular that pertain to kids' access to care and treatments, two bills we've been working very hard on over the course of the last little while, and to those of you who've been joining us over the last little while, also legislation that you may be familiar with, as we've talked a bit about it before. I am Paul Mellmeyer. I'm the Executive Vice President of Public Policy and Advocacy at MDA. I'm going to be your host, and I'll also be covering some of the agenda that you see in front of you. We're going to start with some housekeeping and introductions, and then from there we're going to talk about kind of what's happening in the public policy sphere right now. We're going to zoom out from neuromuscular conditions or MDA specifically, or even the bills that we're talking about that you see there within the agenda. We're going to talk about kind of the end of year environment and what's happening on Capitol Hill right now, what's happening in the administration right now, and why this is kind of a really special and unique time in public policy making in DC. And then for that reason, for why it's kind of a special and unique time, why we are really pushing the passage of two bills: the reauthorization of the Rare Pediatric Disease Priority Review Voucher Program, and then the Accelerating Kids Access to Care Act. And then from there, we're going to talk about how you can help us pass these two bills. And then, of course, we'll be taking your questions. So speaking of questions, let's move to the next slide, which is our housekeeping slide. For those of you who have joined us before on WebEx, I'm sure you are very familiar with how to interact with us as we are going through the program. But just in case there's any new folks with us, the ways in which you can interact with each other, of course, you can put messages in the chat. And Kristen, thanks for saying hi to everybody there. But if you want to submit a question for us, please put that in the Q&A box. And you can find the Q&A box at the bottom of your screen. You see those three little dots at the very bottom right of your screen. Just open that up, and then one of the options will be Q&A. And then feel free to submit a question for us to answer as we're going along. And then for those of you who would like to utilize closed captioning, that's at the bottom left of your screen. You see the little CC within the quote box there. Just click on that, and that should enable closed captioning. So who is going to be speaking with you this evening? Of course, I've already introduced myself, but you'll also be joined by, again, if you've been with us over these Advocacy Institutes, two familiar faces. Joel Cardner is our Director of Access Policy, and Mark Fisher is our Director of Advocacy Engagement. And together we'll be talking to you about these pieces of legislation and how you can help get these bills across the finish line with us. So let's move on to the first topic. And that first topic, as I mentioned, is public policy and the end of the year. And as I already alluded, I feel like a little bit it's kind of the most wonderful time of the year for us within public policy making, because it's when those who are decision makers, those who are policy makers on Capitol Hill, as well as oftentimes within the administration, they have one of these non-artificial deadlines, those deadlines that if they aren't to do something, then bad things will happen. They have that hard and fast deadline they need to act by. And at the end of each Congress, and the Congress goes in 2-year cycles, then the Congress has to start all over again with the legislation they've been working on. And that deadline is coming up. I believe, if I remember correctly, the new Congress is sat on January 3rd, something of that nature. Beginning of January, we'll put it that way. And so all of the work that these congresspersons have been doing for the last 23 months will expire if they don't get the bill passed by the end of this Congress. And so oftentimes that means there's a big flurry of policymaking. There's that big effort up on Capitol Hill to actually get legislation passed by that deadline, because they've been working on it for so long. They don't want all that work to go to waste. They want to see if they can actually get this stuff passed. And then they also have the deadline of the holidays. It's actually somewhat convenient that many members of Congress are wanting to go home and spend the holidays with their family, and so they're wanting to get all of their work done. We all want to get all of our work done before the holidays hit, so we can enjoy some quiet time and rest with those who we care about. And so consequently, we see this flurry of policymaking at the end of any year, but especially at the end of a Congress where we're sitting right now. Congress right now has a couple things on their list that they have to get done before the holidays hit, and certainly before January comes around and the new Congress is sat. Right now, funding will expire on December 20th for the government. I believe for the entirety of the government, funding will expire on December 20th, meaning they have 9 days from today to actually pass a funding agreement for the government, or the government will shut down. And by and large, congresspersons don't want to see a government shut down 5 days before Christmas. This is oftentimes the time in which they might be most willing to negotiate and compromise and not look for a political fight. They oftentimes will look for political fights elsewhere in the year, but rarely does it happen here at the end of a Congress, certainly, and the end of the year right before the holidays. And so it's more likely that they will be able to pass a funding extension by their deadline of December 20th. And it's as of now looking as if they are going to pass a 3-month extension of the current funding levels, and that's called a continuing resolution. And so that's expected to go into March of next year. So that's kind of the funding side of what Congress is wanting to do, and by and large, that's kind of, I mean, nothing is set in stone, nothing is certain, of course, within what we're working on here, but it seems to be pretty well understood that everyone's in agreement. Let's extend funding into March of next year at our current levels, and then within next Congress and the new administration, let's tackle funding levels again March of next year. Now, at the same time of trying to pass this funding agreement by December 20th, they also have all of this policy that they've been working on for the last 23 months that they want to add to this bill as well. And when there's something that is a must-pass bill on Capitol Hill, and funding the government past December 20th is indeed a must-pass bill, that makes it a lot easier for them to add other legislation that's oftentimes bipartisan in nature. And just in case the legislation isn't bipartisan, maybe the Democrats have something that's partisan, the Republicans have something that's partisan, they'll agree, okay, we'll allow your bill to be on there if our bill gets to be on there. But in the end, both parties have to agree because, of course, the Senate is controlled by the Democrats, the House is controlled by Republicans, and the White House, of course, is controlled by Democrats right now as well. So it has to be bipartisan. Both parties have to agree on what passes. And there's a number of different policy issues that very well could be included within this end-of-year package. For example, there's conversations on having an extension of the Farm Bill that, of course, is very influential in agriculture policy. There's policy in other areas, like such as in defense or in disaster relief or in immigration, perhaps even, that could potentially be added into a bill that is intended to pass by next Friday. So there's a number of different policy priorities that those on Capitol Hill have, that those within the different communities that are advocating for policy have. Everyone has their priority they want to see added to the end of year package. Now, while this is what Congress is focusing on, there still is a role for the administration. Of course, anything that passes Congress still has to be signed into law by President Joe Biden. He is the president until a certain time on January 20th. And so, consequently, the administration is involved in these negotiations as well. They are only going to pass, or they're only going to sign things that policy that they actually agree with. Now, I've been very focused on what Congress is doing, but frankly, the administration is also trying to get a lot of stuff out the door, perhaps before the holidays, or if not before the holidays, at least before they leave power, if you will, on January 20th. So we're very focused on getting these bills passed that we're going to talk a little bit about more here in a second. But at the same time, we're also encouraging the administration to finalize their proposed rule they put forward back in the spring pertaining to accessible air travel for those who are wheelchair users. This is still something that, in joining with our disability advocacy colleagues and other organizations, that we're pushing for the administration to do. And we don't have any good news to pass along yet, but we're hoping within the next couple of weeks we'll be able to pass along some good news that this administration has finalized that rule. And that means that that rule will be taking effect starting likely parts of that rule will start taking effect next year and beyond. So the administration is still working hard on getting some of the regulatory stuff that they were trying to get done by the end of their term. And then, of course, they're involved within the congressional negotiations. So what dynamics are going to impact what policy passes at the end of the year? There's a couple things to mention here, because the dynamics that are most at play are what next year and the following year are going to look like, but especially next year, because of course, anyone who followed what happened in the election, and I'm pretty certain everybody who's on the call here knows what happened in the election, that Republicans have unified control of the federal government next year, of course, with President Donald Trump coming back into power, as well as Republicans taking the Senate and maintaining their very narrow lead in the House. But because of this, there's negotiating positions that the Republicans and Democrats can take, or cannot take for that matter, this year. And something that Republicans in particular are looking at are there things that we might not want to pass this year because we want to be able to pass them next year under a Republican controlled Senate, House, and presidency? Things that might be very popular, things that are they want to be able to take credit for. And both parties do this when they are moving into power. This isn't certainly one party or the other. If they have the opportunity to do things that are going to be more along the lines of how they want to do it, along how they will be able to gain credit for it, then that might be held until next year. The other thing is that we know that there are lots of ambitious policy goals that incoming Republicans have, both in Congress as well as in the administration. And consequently, they're going to want to be able to pay for those policy goals using other policy that saves the federal government money. So things that could have been passed this year that actually saves the government money might be held until next year to allow for that policy to help pay for the things that in particular Republicans want to get done next year that might be expensive, such as tax cuts or other or border security or energy policy, things that are priorities for them in next Congress, but might be expensive. And so they want to hold things that could actually save money into next year. So what does that mean? What does that mean for us? What does that mean for MDA? What does that mean for the neuromuscular disease community and our priorities? It means that it's a little bit of a complicated situation that we're dealing with on Capitol Hill right now. And that it's still actually rather unclear. Here we are on December 11th, and December 20th is coming quite quickly. You might think, well, shouldn't we kind of know what's going to happen by December 20th by now? Absolutely not. Negotiations are still ongoing. I was actually just on the Hill, an hour and a half ago getting updates on where the negotiations stood, and they are still quite fluid. So that leaves what we're trying to do still a little bit up in the air. And then the other thing is that you've heard us talk about a lot of different policies this year that we have been trying to get across the finish line. That includes the SSI Savings Penalty Elimination Act. That includes legislation to expand access to genetic counseling services, or the ALS Better Care Act, or legislation pertaining to employment for those with disabilities. There's a whole host of bills that we've wanted to see actually pass this year, but given the environment that we're within right now, the list has to be very narrow. The list is only those things that are very bipartisan and aren't going to cost a ton of money because of the environment that we find ourselves in at the end of this year. If perhaps the election had gone different ways, perhaps the environment would be different. There's a lot of different ifs that the environment could be different for us. But because of where we stand, that's why we're prioritizing three things. And those three things are extending the telehealth flexibilities that have allowed, especially those in the Medicare program, to be able to see their clinician or see medical providers from home or from a local setting rather than having to travel to their clinic or specialist that might be quite far away. And it's looking pretty likely that an extension of those flexibilities that were passed by Congress during the pandemic will indeed be included within the package that should pass by December 20th. Those flexibilities expire on December 31st if they're not extended, but it's looking pretty likely. So that's why we're not really focusing on those tonight. That's one thing that we want to see happen, and we're feeling pretty good about it. The other two things are the extension of the Rare Pediatric Disease Priority Review Voucher Program and the passage of the Accelerating Kids Access to Care Act. So let's move to the first of those two. And that's our efforts to reauthorize the Rare Pediatric Disease Priority Review Voucher Program. Now, we've covered this a little bit on previous advocacy institutes, so if this is going to be a review for anyone, I do apologize. We'll get to hopefully some new content here on this topic here pretty shortly. But this also might be a new program in general for some of you who are tuning in and you want to hear about what this program is. So what is the Rare Pediatric Disease Priority Review Voucher Program? This is a program created back in 2012 intended to further incentivize biopharmaceutical companies to develop treatments for rare pediatric diseases in particular. At that time, policymakers saw that the incentives for rare disease drug development more generally were pretty good. The incentives for common disease pediatric drug development were sufficient, we'll say. But when you put those two together into rare pediatric diseases, there just wasn't nearly enough therapeutic development happening. So Congress at that point created the Rare Pediatric Disease Priority Review Voucher Program. And what is a rare pediatric disease? A rare pediatric disease is any rare disease defined as under 200,000 individuals in the United States that primarily affects the pediatric population. And the FDA interprets what that means, and they interpret that as the manifestations of the disease primarily affect children, that there are over 50% of those who have the condition who fall within the pediatric age range, or 18 or younger. So then in that case, what is a PRV, or a priority review voucher? And you'll hear me use the acronym PRV a couple times as I'm going along, just for ease of speaking. What a PRV is that if a company actually successfully develops a therapy for a rare pediatric disease, and there are several within the neuromuscular field. There are 8 therapies, 8 Duchenne muscular dystrophy therapies that have received a priority review voucher, 3 spinal muscular atrophy therapies that have received a priority review voucher, and actually all 3 that have been approved received a priority review voucher, and then the single Friedreich ataxia therapy received a priority review voucher. And what a priority review voucher is in that context is for those therapies that have reached FDA approval, the company that got that therapy approved gets this voucher. I like to imagine it's like, looks like that ticket that you see in front of you there, gets this voucher from the FDA to then be able to get a priority review for a future therapy that they have in front of the FDA. Now, most rare disease treatments get priority review. The way priority review works is if it's for a therapy for a serious and life-threatening unmet condition, or therapy with unmet needs, I should say. In that case, then the drug will be reviewed by the FDA in a 6-month time frame rather than a 12-month time frame. It just accelerates the process. And that 6 months can be a big deal, both for the community, of course, but also for a biopharmaceutical company that gets to sell their drug 6 months quicker than they would have otherwise. And oftentimes for these companies that receive a priority review voucher, they don't necessarily hold on to them. They actually sell them to another company that then uses that voucher to get a therapy of theirs across the finish line that much more quickly. And actually, of late, these vouchers have shown to be quite valuable. They've been sold for, of late, upwards of $150 million. And that $150 million for a small biopharmaceutical company that brings a rare disease drug to market is, as you can hear, quite valuable. I think we'd probably all find $150 million quite valuable. So it's a powerful incentive. It's a powerful incentive to be developing therapies for rare pediatric diseases. And as I mentioned, there have been, I think I'm getting my math right, 12 therapies within the neuromuscular disease population that have gotten a priority review voucher. And NORD, our friends over at the National Organization for Rare Disorders, published a study on how effective this program has been, and they found that it's been incredibly impactful. There have been 39 diseases for which a rare pediatric disease treatment has been developed, and of those 39, 36 have been since this program was developed. Only 3 were prior to this program's impact in its creation in 2012. So it's clearly been quite successful. Let's move to the next slide. So why are we advocating for this again? Because this program expires on December 20th. It has the same deadline as government funding. And actually, previous to this, it had a deadline of September 30th. Now, Congress acted to make sure that the program did not expire, and actually funding previously also had a deadline of September 30th. And in one quick passage of a bill and a signature by the president in very late September, Congress both extended the government funding until December 20th and extended the Rare Pediatric Disease Priority Review Voucher Program until December 20th. So we now have 9 days to actually extend this program again, or the program will expire. And what that looks like, it's not actually particularly straightforward. It's not that the entirety of the program just disappears, because FDA, for those therapies that have already received a rare pediatric designation, and what that means is that FDA says, hey, you company with a future therapy, you're still in clinical trials or you're still working towards clinical trials, we're going to certify that if you get your drug approved down the line, that you can still receive a priority review voucher. That's what a designation is for, that kind of a stamp of this is for a rare pediatric disease. And the way that the current program is structured is that even if the program expires on December 20th, therapies that or future therapies that have this designation can still receive a voucher up until September 30th, 2026. So it was 2 years from the previous deadline. Now I guess it's about 21 months away. And so consequently, the program won't cease to exist, but we do know that there are a number of therapies that likely won't be approved because they're further, along in the pipeline. It's going to take a little longer than 2 years for this therapy to be approved by the FDA. And so for those therapies, this expiration would mean they no longer have this incentive, and the company may no longer be incentivized to actually continue development for that rare pediatric disease therapy. And one additional reason for why it's incredibly important to get this program reauthorized is that when a program ceases to exist, it's very hard to bring it back. It's very hard to bring a program back that Congress let expire. Future Congresses aren't nearly as motivated to bring something back if it expired as they are to continue something that it currently exists. And so for these reasons, we're not really actually comforted much by the fact that the entire program won't expire on December 20th, because it would still be incredibly bad if this program did expire on December 20th. We could see therapies that would have been approved by the FDA in the next 5-10 years just not come to market. Maybe therapies for the very first therapy for some folks within our communities. I think about those in the congenital muscular dystrophy community, or some with limb-girdle muscular dystrophy, or rare myositis, or other neuromuscular conditions that are still waiting on that very first FDA-approved therapy. This could be the program that's actually incentivizing companies to continue with their development, hoping that that $150 million incentive will be there upon approval. So consequently, this is why we're advocating so strongly for the reauthorization of this program. So where do we stand today? The good news is that we've made a lot of progress. This bill has already passed the House. Over in the House, the Creating Hope Reauthorization Act is the name of the bill itself, but it's kind of taken on a couple different forms. Over in the House side, they merged the Creating Hope Reauthorization Act with a couple of other bills and called it the Give Kids a Chance Act, and they actually passed that bill in September, which was really exciting. Sent that over to the Senate, and then the Senate was ready to hold a markup on the Creating Hope Reauthorization Act, on the Senate version of the reauthorization of this program. They actually didn't get that markup done. They left town at the end of September before the markup could happen. But nonetheless, it was looking really good in the Senate that the Senate was also going to take action. So where we stand right now is that the House has already passed this bill. In fact, they passed it essentially unanimously. They passed it on the House floor via a voice vote. The Speaker of the House said, "Anyone object to passing this?" No one said anything, so that means that it passed. And over on the Senate side, they were getting ready to pass it, but just didn't get quite to it. So that means that we have a pretty good chance of getting this within the end of year package. It's bipartisan. Those in the House have already passed it. Those in the Senate came pretty close to passing it, but they didn't quite pass it, of course. And so that still adds a little wrinkle of complexity. The fact that neither the full Senate, of course, but even the Senate Health, Education, Labor, and Pensions Committee, the committee that's responsible for this legislation, hasn't held a hearing or a markup on the legislation. And frankly, as we're talking about who needs to be convinced to pass it, it is they. It is the Senate Health, Education, Labor, and Pensions Committee, and in particular, Chairman Bernie Sanders, who I don't think will be a surprise for many on the line here, doesn't think particularly favorably about the biopharmaceutical industry in general. And so consequently, for him to support an incentive for biopharmaceutical development is something that might be a little bit more challenging for him than it may be for other senators, other colleagues of his. So really, we're focusing on especially him and Democrats on the Health, Education, Labor, and Pensions Committee in the Senate, who, while they intended to move forward with this bill, still didn't quite get there, to make sure that they are okay with this legislation being included within the end of year package. But let me conclude my part of the presentation by just delivering what our ask is to Congress, and we can move to the next slide, and what we're going to ask for you to help us out with. And that's to contact your congressperson and ask if they can ensure that the Rare Pediatric Disease Priority Review Voucher extension is included in any end-of-year package. And we word it that way. We don't cite a specific bill name. We don't say Creating Hope Reauthorization Act. We don't say Give Kids a Chance Act. The reason for that is because there are different names for it in different houses. We're naming the program itself, the Rare Pediatric Disease Priority Review Voucher Reauthorization, that extension is within the end of your package that they're negotiating right now. Because while things are looking positive, there's still a lot of congresspersons who probably haven't heard about this all that much. Perhaps your congressperson, your representative, or your two senators just aren't paying attention to this. So if you're to reach out to them and ask, hey, can you make sure that this voucher extension is within the end of your package? Make this one of your priorities, Senator so-and-so, Representative so-and-so. That could really make such a big difference to ensure that the extension of this program is within the end of your package. So with that, I'm going to actually go a little off script and look at some of the questions and chat that's been coming in. I'm just making sure that I cover everything folks have been asking, and then we'll move to our next bill. Deepa has asked, can you speak a bit about what the general themes are of those who push back against the rare disease voucher? Absolutely. So there, frankly, or thankfully, there aren't too many folks who have been pushing back against the Rare Pediatric Disease PRV program, but there have been some who have been skeptical, we'll say. And some of the things that they have said include, we're not sure if this program actually works. We don't have hard and fast empirical evidence that these priority review vouchers lead to more therapeutic development in rare pediatric diseases. Now, we counter that saying, actually, we feel that there's pretty good evidence that this program has been very effective. I already cited the 36 of 39 diseases that have an approved treatment now in the rare pediatric population has happened since this program was created in 2012. We also can point to the fact that there has been a much greater amount of investment in, especially within our rare neuromuscular area, the rare pediatric neuromuscular conditions. We can point to, while anecdotal, the many conversations that we've had with biopharmaceutical executives saying that this voucher is really the only reason that we're continuing developing within this program, that we wouldn't be able to raise the capital, raise the investments from private funders. This is how our private industry-led biopharmaceutical system works, that there has to be a profit at the end of the day for these drug development pathways to continue. But that $150 million at the end of the road there is a big incentive, and it's that the companies are chasing to continue the development of these therapies for our populations. So it's mostly been folks who are skeptical of the program's utility, or it's been folks who have been feeling as if the biopharmaceutical industry has enough incentives. In fact, frankly, maybe they have too many incentives, and that we actually need to be going in the other direction of reducing the incentives within the biopharmaceutical industry. Now, that argument is very easily countered by pointing to the fact of all of the not only rare neuromuscular pediatric diseases, but rare pediatric diseases in general that still have little to no therapeutic development happening at all. And how just looking at that picture is quite obvious that the incentive landscape right now for biopharmaceutical companies, especially within rare pediatric diseases, is adequate at best, I would say. I think most would even argue maybe we need to be looking further at additional ways to bring more biopharmaceutical companies into the rare pediatric disease space. But at the very least, we need to maintain what we have. And so it's really been kind of those two things that we've heard from some skeptics of the program. But again, I'll emphasize, thankfully, that's a very small group of individuals, whether that be on Capitol Hill or off Capitol Hill, that have expressed skepticism on the utility of the program. All right, I would just want to make sure that I cover any other questions on the voucher and before I hand it over to Joel to cover the Accelerating Kids Access to Care Act. Let's see here. I think that can be it for now. So for now, I'm going to hand it over to my colleague, Joel Kartner, our Director of Access Policy. And Joel's going to walk us through the second bill that we're trying to ensure is included within the end of year package, the Accelerating Kids Access to Care Act. Joel.
Hi, everybody. So Paul teed me up really nicely there. We're going to talk about the Accelerating Kids Access to Care Act. And what exactly is this bill? So for those of you that don't know, well, I guess as a starting point, what the bill tries to do is it tries to streamline receiving care for children who are on Medicaid but need to cross state lines to receive that care. For those of you that don't know, Medicaid is a 50-state patchwork partnership between the states and the federal government. And as part of that patchwork, children often who have to travel across state lines to receive care often have to wait quite a while to receive the care that they need when they have to do that traveling. Now, why is that? That's because every time a child, or anyone for that matter, crosses state lines for their healthcare provider has to re-enroll in their home state's Medicaid program, because again, each state has their own program. So they have to re-enroll each and every time that they see that child from out of state. And this process is pretty intensive for the healthcare provider to do. And so that causes them to need to ask these children and their families to wait to receive care so that they can get properly re-enrolled in the Medicaid program. So how does the Accelerating Kids Access to Care Act solve this problem? It streamlines the enrollment process for healthcare providers in general, so it just makes it easier and faster for them to re-enroll, but it also crucially allows them to stay enrolled in the out-of-state program for 5 years at a time. So along with making it easier, we're also making sure that these healthcare providers have to do it less, all of which will speed up the time to healthcare for these children and their families. Next slide. So before we get into the ask, there are a few key talking points that we wanted to go over for you all, just in case you do end up calling a member of Congress and getting into a conversation with their staffs. We're making sure to emphasize that the Act does not impact how states decide what is and isn't covered under their Medicaid programs. It just allows patients to be seen more quickly. A little bit of pushback that we had gotten in the early days of the bill was, well, is this going to mean that the federal government is dictating what a state will or won't cover? No, we're just saying out-of-state healthcare providers can enroll more quickly. There are also some concerns that this bill will open up floodgates in state Medicaid programs. So you'll see this, massive influx of people crossing state lines to receive care under Medicaid. And again, this isn't a massive shift in patients. We're just dealing with patients who are already receiving care in these programs and getting them the care they need faster. So we're not concerned about a floodgate opening here. We're just making sure that people that need to receive the care they need can do so as quickly and efficiently as possible. So where are we now? We're in a very similar position that Paul's bill, the PRV bill, is in. We passed the House, again by voice vote, so essentially unanimously. The wrinkle is the Finance Committee, which is the Senate's committee that has jurisdiction over the bill. They were never going to mark up the bill. They had other things going on, and with as broadly bipartisan and popular as this bill is, they basically said, we'll lean on end-of-year negotiation to get this bill over the line. So there is no action going on the Senate side. What we are advocating to senators to do is to make sure that this bill does in fact make it into any final end-of-year package, which you'll see in the ask here in just a minute. Are there any key targets, though? Yes, there are. So on the House, it's a really wide net. It's kind of just anybody, everybody. Hey, you worked to get this bill passed. Let's make sure that it ends up in a final package. For the Senate side, you could take that approach, but we are emphasizing specifically Senate leadership and also the Senate Finance Committee. Because the Senate Finance Committee, despite not marking up the bill, they're still going to have the most loudest and most persuasive voices on whether or not this bill makes it in or out of any given package. So any senator on the Senate Finance Committee, particularly the Health Subcommittee, are people that we're targeting specifically, and then leadership on Senate side. We can move on to the next slide where I can get you the ask. So what is the ask? It's again very, very similar to Paul's. Please prioritize this bill in any end-of-year package, no matter how big or small or narrow the package is. So again, we really want to emphasize it doesn't matter what the size of the package is. We want to make sure that regardless, it ends up in that end-of-year package. And I see a question in the chat. So I actually didn't mention it, but typically, this is only going to impact people under the age of 18. There are a couple of loopholes where children in foster care are considered children until they're 26. There are a few other minor populations that have different age ranges, but this is primarily aimed at children under the age of 18. And with that, I don't think I see any other questions, and we can move on to Mark.
Thanks, Joel, and thanks, Paul, for that. So we've seen this a few times in the chat as how can I help, what can I do? Both Paul and Joel talked about what kind of we want Congress to do, what our ask of them would be. So you might be thinking, well, how can I do that? Well, there's a few ways that you can help us out. First, on what Joel just spoke, we're actually having a pretty big day of action tomorrow. Joel is organizing a bunch of groups that we work with, similar nonprofits all across DC and across the country that we work with on this issue, and they're doing some Hill meetings tomorrow about it. So we're having a big group, big force having some Hill meetings tomorrow, and we're also then encouraging advocates to join us and make their voice heard as well. So we're calling this our day of action tomorrow, and we're having one final push to get this bill across the finish line. So again, organizations are coming together tomorrow, advocates are coming together tomorrow, and we'd love for folks on this call to join us tomorrow, or you can join us tonight if you would like, and encourage your member of Congress to support this program and to support that ask that Joel talked about and get this in the end of year package. So I'll put some links in as we go, but if you've never taken action with us before, you can easily go to our website, and I'm going to put the link in the chat right now. And go to our website that I put a link into the chat box right now, insert your address information, and we give you a sample letter that you could send to your members of Congress that includes the ask we just said. So if you've never taken action with us before, that's a great way to get started. If you've already done this before, I know many people probably have, on our website, you can do it again as well. It doesn't hurt to remind folks that you still really care about this program. And so we hope that you could do that. In addition, if you want to take action on the Pediatric Voucher campaign that Paul talked about, we have another website to let you do the same thing. So I just put that in the chat as well. You can click on there, it brings up a page about the campaign. You can insert your information, and you can send a letter off to your members of Congress tonight. You can do it tomorrow, when a lot of us are doing it tomorrow as well, to join us and get these bills over the finish line. So you can go to those links. You also can go to mda.org/advocacy to find them that way as well. I have a screenshot on the screen there that shows the two campaigns, but those links will direct you directly there. If you have time, we'd love for you to personalize those letters that you send to members of Congress's office. You can imagine how much email they get. They get more email than they know what to do with. And what really stands out to them is when they see a personal story, a personal message. It really cuts through the noise. They actually have sophisticated software up there that can detect which messages have personal stories and personal more than just a form letter. And those really then rise to the top. So if you have a few moments to personalize those letters, they really make a big difference, and they'll get them seen. And of course, share this with others. Share with other folks that you think might be interested in taking action on this as well. Those two campaign links will work for anybody. Now, I see a few folks in this call that might have had meetings with congressional offices before. So if you have a personal relationship with an office, maybe you met with them before, maybe you met with them in September or throughout the year, feel free to reconnect with them and encourage them to please get these two bills in the end of year package. If you already have those personal relationships, that's super effective, and we encourage you to use those and reconnect with those offices you might already know to make those asks. If this is your first time taking action with us, or you're a veteran, if any of you have any questions, you're more than welcome to reach out to us and ask us for any assistance to help you and assist you with this. So you can contact us at advocacy@mdausa.org. Many of you on this call probably have one of our email addresses. Feel free to email us with any questions with that as well. And thank you, Jory, for advancing the slide. You can see our address there. So if there's any questions, maybe you're not sure what you might want to send to the member of Congress, not sure what you would like your letter to be, feel free to contact us, and we can help you help you do that tomorrow or whenever you have the time to take action, because we're really hopeful we can get these two bills over the finish line. We just think we just need a little extra push to do that. So that's how you can help. You can go to those websites that we put in the chat, or you can leverage any personal relationship you have. Any bit helps. It's really at this time of year, any push will help. So with that, I think we really just wanted to talk about those two bills. I think maybe I'll turn it to Paul and see if there's any Q&A. We can go from there.
Yeah, thanks, Mark. We did see one additional question come up, and I believe that this is for Joel specifically pertaining to the Accelerating Kids Access to Care Act. So, Joel, I'll read the question from Rich. I mean, he asks, can you clarify how this Medicaid Act helps a typical family with kids with muscular dystrophy? And then he follows that with, is there any income-driven support, or just tell us how income may play a role within Medicaid and within access to specialists under Medicaid?
Yeah, so to be on Medicaid in general, you do typically have to be making under a certain dollar amount to qualify for Medicaid. In terms of how this bill impacts a typical family, crossing state lines to receive care can both be very time-consuming and also very expensive. The bill itself does not do anything to help alleviate that cost, but what it does do is it allows them to receive care in a more timely manner, which will hopefully allow them to receive care more quickly. Therefore, their disease does not progress any more rapidly than it already would be while waiting to receive care, and that in turn hopefully drives costs down as well. But in terms of, is there anything in the bill that does income-driven support? No. And then to be on Medicaid, yes, you do typically have to be making under a certain dollar amount, which will vary by state.
Yeah, and for anybody with additional questions, please put them in the Q&A for anything pertaining to what we've talked about today. I'll just mention, Joel, to further add on to the very good points you just made there, just how important Medicaid is as a program to our community, because to Joel's point, there does oftentimes well, each time there is a income ceiling, you could say, for qualifications for Medicaid, but oftentimes state programs will have a much higher ceiling for those with disabilities, have a much higher ceiling for those who are children or families with children compared to a single adult, for example. So while there oftentimes is that ceiling of income for folks to qualify for Medicaid, we see a lot of folks within our community qualifying for Medicaid within their state because they have a disability or because they're a child, because the qualifications, the eligibility criteria is much broader for children as well as those with disabilities. So consequently, Medicaid in general is incredibly important for our community, and you're going to be hearing more from us in the coming months on just how important Medicaid is. We have a question from Renee. Renee asks, can you share more about, let's see here. Sorry, I just lost the question. I believe, can you share more about what's happening tomorrow specifically? So Joel, you've been helping lead our initiative on the Day of Action. Can you mention a little bit more about what's happening tomorrow? And then Mark, I'll invite you to add anything from there.
Sure thing. So on an organizational level, MDA is an umbrella organization for a lot of smaller neuromuscular disease orgs. And we convene what's called the Neuromuscular Advocacy Collaborative for those organizations. So I have organized them to go meet with Senator Schumer's office tomorrow. They also have a letter and various social media toolkit things to make their voices heard on, again, getting the Accelerating Kids Access to Care Act passed at the end of this year. And then Mark, I'll let you speak to the individual advocate.
Yes, absolutely. So Joel's doing the work to get organizations together and get them to come together on Capitol Hill. Then we're bolstering his work by getting advocates to also raise their voices. So we will have an email out tomorrow to many of you probably on this call, many in the Grassroots Network, encouraging you to make your voices heard on this bill. And then really the goal is to bolster the work that we do on Capitol Hill. So you can imagine if you're a Capitol Hill staff member and, oh, you just had a meeting with 4, 5, 6 organizations, and an hour later you get an email from an advocate asking the same thing those organizations just asked. That will just bolster up the message on Capitol Hill. So when we have days of action like this, it is just to really amplify all of our voices, doing all of our tactics together as much as we can. So for folks on this call, you'll get a message from us specifically on the Accelerating Kids Access to Care Act. You'll get that tomorrow. If you know, for as well, you can also make your voice heard tonight as well. And then for folks who again, if you have personal connections with offices, and I think folks on this call know who they are, some of you might be getting more personalized information from us, but if not, you can reach out to us as well. So really the idea is we're making as much noise as we possibly can tomorrow, especially on Accelerating Kids Access to Care Act on Capitol Hill to get that last final push. So feel free if any additional questions, many of you know where to find us. We're happy to fill in more gaps there. But yeah, we're trying to make a big noisy day tomorrow on this bill.
Yeah, that was very well said, Mark and Joel. And if they're getting the noise from different places, if you will, you're writing in or calling in while we're writing in and calling in, while organizations are on the letter, while we're meeting with Senator Schumer's team, all of that happening at the same time, and they have to pay attention to us. So that's why you see so many kind of moving parts, if you will, with our day of action tomorrow. And that's why we time it all for the same day if we can, because that just gets that much more attention. Deepa has a very good question within the chat. He's asking any predictions on where these pieces of legislation may go in the new Congress. Any sense if the incoming FDA leadership will be more or less open to programs to foster innovation, etc. Well, for one, we hope that these specific pieces of legislation will make it into the new Congress. Of course, that probably is self-evident. If we're hoping that they'll be passed by December 20th, that next year we won't be asking you to help us support the Rare Pediatric Disease PRV program or the Accelerating Kids Access to Care Act because we were successful this year. More generally, of course, you'll see us active in both our access to care and especially within Medicaid space as well as the FDA space, trying to get more and better treatments to our community. That mission, that goal never ends because there are still so many communities within the neuromuscular disease patient community that are waiting for that safe and effective treatment that is truly transformative. So next year, as we're looking at how the FDA will be approaching the therapeutic development space within neuromuscular conditions, it's a good question. A lot of it is still a little unclear with the incoming administration. We know that Dr. Marty Makary is the proposed next FDA commissioner. He's a professor and a surgeon up at Johns Hopkins University. Now, he has actually written about orphan drug development in the past. In fact, he has critiqued the current structure of the incentives within the Orphan Drug Act that is the main incentive for rare disease drug development. Now that was, I believe, 8 or 9 years ago. I don't know if his opinions have evolved since then. I don't know if this is near the top of his priority list for that matter. But he is familiar with rare diseases. And he is familiar with kind of the ecosystem for developing therapies for rare diseases. Now, beyond that, a lot of the initiatives the FDA currently have ongoing for therapeutic development within neuromuscular diseases, and that includes the several initiatives that the Center for Biologics is undertaking for gene therapy development in neuromuscular conditions, as well as the initiatives commissioned by the Act for ALS within ALS specifically, but rare neurodegenerative diseases more generally. All of those initiatives we expect to continue largely as they have been, just because they're very popular, they're bipartisan, they're generally not on the target list, if you will, of any partisans or any of the main decision makers that are going to be new next year within the next Trump administration. Now, if we were in other spaces, if we were in the vaccine space, if we were in the nutrition space, there might be some more changes we could be expecting. But within rare disease drug developments, within neuromuscular conditions, we expect much of the success FDA has been leading on over the last while to continue next year. And certainly we will be working closely with FDA to make sure that's the case. And within Congress, I'll just say that there's a couple things that will be happening next year, or at least the conversation will be happening next year and within the following Congress. For example, the Act for ALS expires at the end of 2026, and so that conversation is going to be happening in Congress on how we reauthorize that the programs within that bill. The FDA is funded by user fees, at least in part, from biopharmaceutical industries, those who are actually getting products approved by the FDA. The reauthorization of those user fees are coming up in a few years, and so the conversation is going to start about all of the ways we can innovate at the FDA in addition to reauthorizing those user fees. Those conversations will really kind of kick off in greater earnest next year. And then beyond that, we're still working with our colleagues on Capitol Hill, especially in Republican leadership, to understand what priorities they have within FDA and therapeutic development policy. So stay tuned. Trust me, we'll be talking about all of this within our future advocacy institutes next year, whether they be general about the outlook or specific to any of these issues. We'll be covering all of this within our advocacy institutes next year. So please stay tuned when we are fully focused on 2025 after hopefully, knock on wood, we've gotten our work done here in 2024. Okay, let me see if we have any other excellent questions here. Toby has asked, what about equipment financial help since MDA isn't helping out with that? So we are working on legislation pertaining to access to durable medical equipment and medical devices. Joel, not to put you on the spot, but I know there's some work that you've been doing with colleagues in spaces both within kind of the medical device development industry as well as elsewhere on trying to make medical devices more accessible. Anything that you want to say on that?
Yeah, so we work with the ITEM Coalition on getting better and more access to medical devices in general. Senator Duckworth has also expressed interest to us specifically on things like right to repair legislation, which would make it more financially feasible to repair your own durable medical equipment, which both more financially doable and also faster than we can currently do it, which should be a massive help. And in general, there kind of has one of the things we've struggled with durable medical equipment in general has been kind of a lack of appetite in Congress to do something on that. But over the last couple of months, there's actually been more of a groundswell on trying to address those issues. So I'm actually more optimistic about that in the coming Congress. So yeah, we'll see what we can do.
Thank you, Joel, and thank you, Toby, for the question. And as Mark and Kristen and others have reiterated, please contact our resource center for any other additional assistance that we may be able to provide. So I'm not seeing any other questions within the chat, and I'm going to go over to the Q&A to make sure we're not missing anything over there. And not seeing anything over there. Maybe I'll just give it another 10 or 15 seconds in case anyone's typing right now and they're furiously trying to get that question in. But I think for the most part, we have covered everything that has been posed to us. I'll just reiterate the main points. Please do reach out to your congresspersons. You can do it tonight if you're feeling ambitious, but tomorrow is the day of action. And please do reach out to them asking for their support and assurance that the Accelerating Kids Access to Care, that they'll support the Accelerating Kids Access to Care Act within the end of year package, as well as the extension of the Rare Pediatric Disease Priority Review Voucher Program. Mark, I see you just put the campaign again in the chat. Thank you for doing so. And otherwise, I think with that, we can wish everybody a good rest of your evening, and hopefully we will have some very good news to share with you all in the coming week and a half or so with the passage of this legislation. But it's a lot of work to get there, and thank you for joining us in making sure these bills will pass. So with that, again, thanks all for joining us. We'll see you again soon.
Thanks all.